to the Stronger After Stroke podcast. I'm your host, Rosa Hart, the stroke nurse navigator for Norton Healthcare, and my guest today is our head of integrative medicine for Norton, Dr. Rachel Busse. So she has been practicing as a family physician with us for how many years? Because I've known you over a decade.
Since 2012.
Okay.
So, 12 years almost.
Fantastic. And we are so thankful to have your expertise here because she is board certified in both family practice and is it board certification in integrative medicine as well? And that is so rare. Like, I don't know that there's anybody else in our city of Louisville even.
I think there are others in Louisville, but that is a newer thing where originally people sort of studied it on their own, but now there is a board certification.
Yeah, and it's so hard to find a physician who understands traditional medicine that can prescribe you things, who also knows what herbal things or natural things might be options, because I think a lot of people just don't want to comment on it because they don't know about it. They're like, I can't tell you one way or the other. And so it's been so nice for me to know you and have that expertise to refer to. So thank you for being here today to do that for our stroke patients.
Thank you for having me. Yeah.
So to start off with, why does someone who has a stroke need to have a primary care physician and also see a stroke neurologist?
Good question. I think of primary care as sort of your coach, your kind of quarterback, sort of putting the pieces together, where hopefully they're going to know about all your different health issues and be able to figure out if any of those play into maybe your risk of previous stroke or future stroke, but also look at, what are maybe some of the barriers in your life that keep you from being able to accomplish what you're trying to do? What are your goals of quality of life? And, many people who have a neurologist also have other health issues where they may require a different specialist. And so sort of getting all that communication together. But I think of myself also as sometimes a translator. So I'll have patients come back to me at times after they see a specialist or with a new piece of information, kind of just wanting to talk it through and better understand what that means or kind of hear it in lay language. But also, hopefully, we've had a long relationship together, so we've been able to kind of figure out what helps to motivate that person or what sort of resources they may have, things like that. But it can be helpful.
Yeah. That's a really good explanation. And a very common question that I have from patients is maybe they've come in to the hospital having a stroke and maybe they didn't have a primary care provider, or if they did, they didn't see them regularly. So they come in and have a stroke and find out they have high blood pressure or diabetes or high cholesterol. And they're like, I didn't have all this before I came in the hospital. Well, they did, but they didn't know.
Right.
And so they get discharged with like 5 new medications and they're not used to taking pills. And they're like, why do I have to do all this? Is there a natural solution? So what would you say to someone who's asking for a natural solution?
That's a good question. And I definitely hear that from patients too, where they're like, I didn't have any medical conditions. And then I went to the hospital and now I have this list. But it's just more that they got named, right? And our goal is to be as early in the process as we can with either treating a condition or with prevention so that we can kind of keep it from getting worse and maybe kind of stop it in its tracks where we are. But as to the natural question, I think it's not an either or. So meaning I would love for my patients to do as much as they can through diet, through lifestyle, through stress reduction, through all the sort of non-medication and non-surgical options that we have, with the hopes that they can be on as few medications as necessary. But I'm also pretty clear about, we live in this time where we have a lot of advances in modern medicine, and thank goodness for many of them. You think about the days of what if we didn't have C-sections or didn't have insulin or didn't have our urgent therapies for when someone comes in with a stroke, or ways to understand why they had a stroke and preventing future ones, cholesterol, a whole host of things. And so I think kind of finding a way to make peace with that, to express gratitude that, okay, this medicine exists to help keep me healthy, but my goal is to be on as few medicines as possible. So what can I do? Can I lose weight? Can I eat less salt? What would help me to be on fewer things to keep it as simple as possible? But to me, it's kind of a both of what are the key medicines that I need and why do I need them so that I can kind of understand that. But then what can I do from a lifestyle standpoint to be as healthy as possible?
And would you say sometimes it's helpful to use the medications as a bridge while they're building healthier lifestyle habits?
Yeah. And so I definitely talk with people about that too. Let's say they have diabetes or they have high blood pressure and they need more medication at this time. If time goes on and they're able to change some other things in their life and able to need less of those medicines, then perfect. We aren't stuck at a level. There are certain medicines, if you're on a blood thinner, you're on a blood thinner, right? But things like diabetes medicines and blood pressure medicines and even cholesterol medicines, the amount that you need is going to vary depending on sort of what all is going on.
Right. So if you are able to change what you're eating and exercise more and lose weight, then that can make your dosage of your insulin or your cholesterol medicine go down or even not be needed for some people, right?
Correct.
Yeah. And that's such a hopeful way to look at it too. I mean, some people would rather just take a pill and not have to make any changes to their life, in which case we wouldn't be having this conversation. But I'm so thankful that we do have this option for understanding. So can you talk about nutrition supplements and herbal remedies that might come into play?
This is an interesting part. So just to give a little definition, so integrative medicine is sort of holistic medicine, so mind, body, spirit medicine. So looking at herbs, vitamins, supplements, stress reduction, nutrition, all kinds of things as far as in addition to regular medications and sort of conventional medical care. So that's integrative medicine. Now within that, herbs and supplements are probably, I don't know if they're the trickiest piece, but they're the piece that could create some harm if we use them inappropriately. So my sort of
in combination?
Yeah, in combination with other medications. So like if you want to meditate for your rheumatoid arthritis, the risk to you is quite low and probably there's a benefit, right? Whereas if you were to take an herbal supplement that interacted with your medication, it could be a higher risk. So that's a place where I really encourage folks to be in communication with their providers about if they're taking supplements and herbs and what they are. Now, depending on your physician or provider, they may have more familiarity with it or not. If it's a less common supplement or if you're on a lot of medications, a good rule of thumb is if you need to take a number of medications, you might not be the best candidate for herbs and supplements.
Because
part of it,
the risk of interaction is higher because there's just so many more factors.
You're on more medication. And then also these medicines these supplements haven't all been studied in conjunction with medicine. So we don't always know what the interaction is. So to me, the more important your medication, so if you're on a blood thinner, for example, if you're on a chemotherapy agent, if you're on, some of these things, we really have to make sure that we're not interacting with that medicine. And so a lot of our herbs are ones that may interact. Now, typically vitamins, basic vitamins, a multivitamin, vitamin D, a probiotic, those are less likely to interact with your medications, but herbs, meaning things that come from plants and flowers, are actually more likely to go down the same pathway as some of our medications. So it's particularly important to be in communication with your provider and say, is it okay if I take this supplement? And they may say, I'm not sure. The safest thing is to hold off. But for example, St. John's wort is a very common herb that's used for mild to moderate depression, well studied, good studies coming out of Europe, used for a long time. Interacts with many, many things. Paxlovid, which we use for COVID, birth control, statins, blood thinner. I mean, it has many interactions. So there are some things that you would think, oh, this is just a mild, I'm just taking it for my mood. It wouldn't matter, but it actually does. So I would really encourage folks to mention to their providers what they're taking.
Yeah. Are there any that you know of that might interact with, and let me define interact real quick, because we're interacting in this conversation, just talking to each other, and that's not causing any harm, right?
Correct.
But an interaction with the medication could be either making that medication just not effective at all, right? And so if they think they're protected by a medication and something else they're taking makes it ineffective, then really they're not protected. And then on the other hand, it could cause a side effect by causing an exacerbation, right?
Right. Some of the interactions make a medicine stronger and some make it weaker. So if you're talking about a blood thinner, that's a really big deal, because if we're going to make you bleed more or less, we usually don't want either of those things. And so an example of a lot of the ones that may come into play for stroke patients would be all the ones that interact with blood thinners. We're taught to remember it with herbs that start with G. So ginkgo, garlic, ginseng. There's another one I'm forgetting at the moment. But it's a lot of the G's, and those actually make your herbal supplements more likely to cause bleeding.
And you don't mean like garlic on your pizza.
Correct.
You mean taking
taking
capsules of large amounts of garlic, for example.
So to use, ginger was the other one. The G would come. So ginger and garlic, fine to use those with cooking. But if you were to take them in a supplement form, it might interact with your medication.
That's good to know.
Yeah. So
and I hadn't even heard that.
So yeah. And then green tea, interestingly, so all of the ones I mentioned before may make you bleed more. Green tea, on the other hand, can actually lower your INR. If you were on Coumadin or warfarin as a blood thinner, then it can make your that less effective. So it's interesting.
Yeah. And then turmeric, I've seen, is one that interacts or can increase the risk of bleeding in a high amount.
In high amounts. And so that's one of the questions, is how much are people taking? Another thing to be aware of is our supplements that are available, just over the counter, aren't monitored in the same way as medications. So they're monitored more like food products than like, medically active substances. So that means that you don't always know exactly how much you're getting. That's the challenge. Even if it says this many milligrams, when they've done additional tests on some of these products, there can be a real variation in what is in the product. So that's where, my thought for anyone who's on a blood thinner would be to try as much as possible to get your nutrition through food, and if we're looking at trying to help you feel better in some way or boost your energy or something like that, can we do that through food versus through a lot of herbal supplements?
Okay. Well, that's very doable. Yeah. So let's see. We've talked about those general medications and what they can interact with. So if we are heading towards food as the solution for getting our nutrition, would you say that you recommend a certain diet to your patients for that?
So there is some good research behind the Mediterranean diet, which many people have heard of. It's been studied for a lot of different reasons, but it has been shown to be helpful in patients who have a history of stroke. It's also been shown to be helpful for patients who are trying to prevent dementia, which so often there's an overlap in kind of neurologic
overall brain health in general.
Overall brain health. And so what we find, and really the key concepts with the Mediterranean diet, this is not going to your favorite Italian restaurant and ordering up everything off the menu, as good as that sounds. This is really based off of people who have longevity living in the Mediterranean community, and they tried to understand why. And what they found was they ate a very unprocessed diet. So the number one goal is as few things from boxes or shelf-stable containers or a long list of ingredients that include refined flours and sugars and oils and those sorts of things. This is really as much as you can working with unprocessed foods, which may sound daunting if you're not a big chef, but there are easier ways to do it. You can get your frozen broccoli that you steam, and you can grill some chicken and, make some brown rice. Like, it doesn't necessarily have to be that you have to be an amazing chef. But the idea behind the Mediterranean diet, when you're eating grains, you need to be whole grains, more vegetables than any of us get, both leafy greens and colorful other vegetables, more fruits, especially those that have fiber. So, berries or fruit that has the peel on it, like an apple or pear or something like that. More nuts, more seeds. Olive oil is our primary source of fat, and nuts and avocados and things like that. But olive oil in place of butter or cream or, other oils and things like that. That's our primary oil. They studied it with and without alcohol. There's a question there. A little bit of alcohol, perhaps red wine may be okay, but more alcohol may be an issue. So there's still studies going on there. And then limiting all kind of sweets and processed carbs. So, but the other piece of the Mediterranean diet that people sometimes forget is it is based in communities where people are walking more, less sedentary, drinking plenty of water, eating and living in community. So also sort of, seeing if there's ways you can kind of bring joy in sharing meals with other people and sort of building a good network around you. Yeah.
I love that plan. I love eating with other people. It makes it so much more fun. So I know a lot of the time it's more tempting to me to eat unhealthy things when I'm alone as well. So there's some accountability as well when we're eating with other people sometimes. Sometimes it's in the other direction. I guess that could go either way, right?
Oh, and the other little bit with the Mediterranean diet, I forgot, you probably wondered about protein.
Yes.
So chicken, fish, vegetarian sources of protein, limited red meat, and then plenty of your healthy herbs and spices. So a lot of those have been shown to be anti-inflammatory. So that's where garlic and basil and rosemary and some of these things are beneficial as well.
Excellent. So we have some people feel like they love their primary care provider so much, like I do, that they were like, why do I even need to go see a specialist ever, right? Even if they did have a stroke. So I know when we talked earlier, I want to circle back to answering the question from a patient's perspective of, I don't want to have 5 different doctors. Do they even talk to each other? So from your perspective as a primary care provider, when do you feel like it's helpful, or what do you get to give to your patients when they get to see a specialist like that?
So I think, when you have, let's say, an ongoing health issue that requires a little bit more complex care, like you've had a heart attack or a stroke, or maybe history of a cancer, you really want that benefit from the specialist, in my opinion, because if you can see that person, and it may be as time goes on, you will see them just once a year, less often, hopefully your schedule won't be full of doctor's visits, but then that's going to be somebody who's able to stay up to date with the latest literature on exactly what do we know for prevention, what tests should we be using to screen, because our goal with any bigger health condition is really about quality of life, right? To get you as close to your baseline as to, or where you want to be, but also preventing any additional events, And so I think having the specialist there is going to be super helpful. And then often we're in good communication together, which is a nice thing. If you are seen in a system where your specialist and your primary care are on the same electronic medical record, what that means is that it's very easy for us to see, oh, you just saw your neurologist last month and they wanted you to start this medication. How's that going? Where we can even kind of follow up on some of those pieces. Or if one of us orders labs, the other person's going to be able to see them. So that part is helpful. So it's a team-based approach, where I get it. No one wants to have to go to doctors more than necessary, but the goal with prevention is that it's kind of reducing the needs for urgent visits or for sort of going to the ER or symptomatic care or being in the hospital. We'd like to prevent that as much as possible and be 2 steps ahead.
Yeah, I think that team-based care is one of my favorite things about working here, because we get to touch base with each other, and nobody has to be the expert in everything.
Right.
We can all rely on each other. So if you are looking for more information on how to eat healthy after having a stroke, the American Stroke Association does have a whole section on healthy eating, and I will be putting that in the show notes below. So check that out. And then if you need a primary care provider, wherever you are in the world, you might need to check with your insurance provider to see if there's like a preferred primary care in your area. And if you are in the Louisville area, you can find a primary care provider calling 629-1234 and then press option 3. And they will get you set up with a new primary care provider to be the hub in the middle of the wheel of your care, like she was talking about, pulling that team together. So thank you so much, Dr. Bussee, for taking your time on your day off to share this. And I really appreciate all the work you do for our stroke patients.
Well, thank you. Thank you for having me. I think I feel lucky to work in a system where we do have this team-based approach and really get to kind of partner in care. And I think, thinking about that for each of us and our own health is sort of, optimizing our health as best we can through what we do with lifestyle, but also with having a good team around us that helps keep us motivated and making sure we've got the best care we can. Yeah.
That's right. And every year, Dr. Busse hosts a symposium called the Integrative Health and Wellness Symposium. So it does offer continuing education credits for physicians and nurses, but it's open to other people in the community as well, right?
So yeah, it's not just limited to Norton employees. It is, I think the primary audience is folks who work with patients directly. So it may be physical therapists, chaplains, as you mentioned, nurses, and primary care providers.
The whole team.
Yeah, the sort of the whole team. And the hope is to help build a community so that those of us who are really interested in this more holistic philosophy have people to talk with and people to kind of share stories with, but also to learn some of the techniques that may be useful for us individually as we deal with our own stress, but specifically to help us with patients. And so we have different talks, sometimes acupuncture, mindfulness, yoga. We've had massage therapy, all kinds of different topics. And part of it is experiential, which is really lovely. So you get to go and maybe make your own aromatherapy spray or make your own superfood salad. So it's kind of fun.
Yeah. And it goes back to what we were talking about with community. So many people after a stroke feel isolated, and we were talking about eating together being an important way to build community. And when we do get to build that community with other members of the healthcare team, then we can take better patient care because we know who to talk to if our patient has an issue or like, who is the expert in this subject?
Yeah, I agree. It definitely takes a village, and I think that's what we're learning more and more, in all of healthcare, is if we can kind of work together and lean on each other and help each other out.
All right. Well, thank you for listening to the Stronger After Stroke podcast on YouTube or whatever audio platform you're on. Leave a comment wherever you're listening so we will get to hear your feedback as far as if this was helpful or was there a question you have that we didn't answer. Feel free to leave that in the comments and subscribe wherever you're listening so you'll be notified the next time we have a new episode. And I'll see you then.